we'll move on to what it means to be well after treatment for melanoma. It will be presented by our Dr. Liu from KP San Francisco.
Thanks, Sherry. It's my great honor to have Dr. Raymond Liu here. He's the Cancer Center Director of San Francisco and the Assistant Professor of our Kaiser Permanente Bernard Tyson Medical School. One second, I will share my screen.
Hi, everyone.
And I would like to say that I hope a lot of you will recognize him from our Beyond the Clinic Living Well with Melanoma. He's in that way our celebrity. It's a podcast series that we've been co-hosting together with AIM, and Ray, I just have to tell you, I have to thank you for all your insights and the guests that you've had. Tell us how it all got started. I feel like it was like yesterday.
Many years ago now. So, Taki, I just want to express the gratitude to AIM Melanoma and to you and the team, Eric, and our IT, and all the folks that have helped make this possible. All our speakers, even our patients have been on the podcast, and it's been great, and it's been a humbling and learning experience for me. So I just wanted to express that gratitude. It all started. Actually started for me as a caregiver for my mom. There's a lot of cancer in my family, and I took care of my mom now. It's been 13, 14 years ago with cancer, and as a caregiver, but also as an oncologist or emerging oncologist at the time, I started asking questions. I always wondered whether there was more than just the science or what was happening with the technology and the fancy new drugs. And I really started asking questions about what it meant to be a caregiver, what it meant to be an oncologist, and what it meant to be human. And so I've been thinking about that. And then you gave me this opportunity pre-pandemic to do our last version of this talk, right? A survivorship talk. And it was wonderful. And unfortunately, the pandemic hit. And what we really wanted to do was to really think about what's happening day to day, to connect with the people just like the folks on this call. And we created this live series and then turned into a podcast. And that was 2021. We did the live series. In 2022, we turned to a podcast. So it's been a couple of years, but it's been wonderful. I'm so grateful.
I love how humble you are. To all you out there, if you haven't tuned in, I'll let you know. This podcast is in the top 30, if not top 20 podcasts on Spotify and under health and wellness. You're in season 2 at this point.
Season 2.
It started out as a video cast for some of you who remember when we first had the kickoff during the 2020 earliest pandemic. But now you're on podcast, and everyone can listen to it anytime. You don't have to log in a specific hour. You can just save it. And I love how this year started. And I mean, I feel like it's very emblematic of the series that I think is so fantastic, because you address all aspects of what it means to live with melanoma and to live with cancer, but also specific melanoma. You had the first one this year, the grieving brain on love and loss, and then functional nutrition for cancer survivors. How was that? Those are very different topics.
I have learned so much from each of these topics, and I want to give a shout out to thank you so much for loving the podcast, for those who do. And we're always looking for new ideas, so let us know. Each one of these topics has sort of, we actually centered, it was Anne's idea, we could center around some books too, some websites. Dion has a fantastic website. And Mary Frances O'Connor has a book about grieving, and I actually learn so much from these. And I'll just give you an example. So some of these themes are coming back over and over again, and whether it's a different topic, I'm hearing the common themes. And so, for example, when we think about nutrition, I really take it back to what are the physical things we can do to support ourselves. And in that case, how is food our medicine? How do we enjoy food? What's the culture that we create around food? And how it can heal us and nurture us. And the physical nature of being there, being present, is really, really important. So sometimes when we're in that funk, it's okay to have an ice cream. Yes, we want to eat right. That's what we're also learning from in other scenarios. So nutrition is so important, but it's really part of this larger physical sense of how do we use exercise. You heard one of our the folks on this call today, exercise as nutrition, or an exercise as healing, nutrition, and also just overall being in the moment, being present, and being well. So I love that about nutrition. Now, in contrast, the grieving brain. So Mary took a different process, and she said, let me understand what grief means from a neuroscience perspective. And it was so fascinating because we start understanding why it takes time, and why it's not just about time, but it's about how we can grow from it, and how our brains form new connections, and we form new connections, and how we can come out of that grief. And so I think we talk about acknowledgement of where we are, and then we talk about some solutions. And often we point to things that Melanoma has to support people. So these are very different podcasts, but they have common themes of healing and growth.
Yeah, and I mean, they apply to so many different situations, right? Whenever I tune in, I mean, there's grief. We all have different grief. And I think after the pandemic, I think everyone will be able to list something that they feel has given them a sense of loss, right? There's the loss in terms of having the diagnosis. There's a loss of persons. There's a loss of a type of lifestyle. So I feel like it's just wonderful to think about that more and have space for that, because in an office visit, that's hard to always grasp at. The priority in the office visit is the medical, but when you're out, you want to be wholly well and connect who you are to all of your life, and who you are is in part also, if you are a patient, what your diagnosis is. So I love that. I love that, this is a continuation for the last 2 years. Like when I put this together, I was like, oh, wow, time's really kind of flown. Looking at all the ones you've done, the two threads that really sort of pulled me in are, on one hand, and I love that actually from our survivor panel just now too, with Mike, Patty, Marta, and Joe, that, the podcast where it's about finding the inner strength in different aspects, either healing through music, food, spirituality, or how to cope with everyday life. How do you see it? How has that been for you to walk through with experts through these topics?
I've learned that being a doctor is more than being a doctor. It's about honoring the experience that's happening. And you heard that in the last session with the folks on the call. And, I want to just finish that theme with what Martha said about, I can't run anymore, but I've done yoga. And I want to just honor that and acknowledge that, because this was an expression of grief of who I was before, right? I was a runner. And yet there was growth from that. There was growth of, okay, now I'm going to do yoga. I'm going to find new experiences to get me past that grief. And we have folks talking about living in the moment. I love that. I've learned so much from that, Takeo, because, these are lessons we can learn. These are life lessons we're learning about how to empower ourselves, how to acknowledge who we are, how to be in that moment. And maybe I could just also say something that I've learned a lot, which is there are some emotional things that happen to us when we go through cancer and melanoma and through life. And sometimes we think about the shoulds. This is where social media happens, right? Oh, everyone's so happy. They're posting, everyone's on vacation. It's always like so positive. But what I've learned through a lot of these podcasts is that it's okay to hold this like ambivalent feeling about anything in our lives, right? That just as we have grieving a loss, that we're also trying to form new experiences, that we have, as we get older, that we're losing some function, but we're gaining some wisdom. How do you hold joy and sadness together in the same space? Acknowledge that some feelings can come, both those feelings can come at the same time or at different times around the same subject. And I've learned so much about how to first look internally and say, yeah, those feelings are there, and to honor them, and then find some tools to move forward? How do we manage the shoulds? Should do this, should do that. How do we manage the anxiety? How do we manage the ever presence of social media, and how we take some control over that? And one of our speakers said, how do we take agency over that? I love that word.
Yeah, actually, that was the other thread that I found. I think while we are, when you exit the clinic, you are out there with your family, with your friends, with your coworkers. As a patient, the reality is there is a little tether that brings you back to medicine and your diagnosis. And how do you manage that? How do you balance the two? Like, it's never going to be fully one or the other, or shouldn't be fully one or the other. So I love all the different stories that you and experts that you gather to discuss these issues. Melissa as being your own advocate, because she's been a practitioner in this field for so long. I love that I heard multiple times today, scanxiety.
It's there. It's real. It is real. It is real.
It's real. We've heard it. And dealing with sun safety issues. I think that must be another mirror from, like you're saying, it's a different part of being a doctor in a way, right?
Yeah, and actually, what I want to honor too is that I've realized that our caregivers, it's not, I just also want to acknowledge that right here, which is a lot of the themes that happen are really around a community. So it is around the person that's struggling with melanoma, but it's also the community and the folks around them, and how we can honor our caregivers, how do we build that community, how we can advocate for ourselves, advocate for our loved ones, and how we can remain well together. So I love how Melanoma's really brought the community together for us to talk about things. And Beyond the Clinic is like perfect title for it, because we don't really talk about it. And I'm trying to, what I've learned, is I'm actually trying to bring that to my clinic. And I hope, I know this is oftentimes this podcast for our patients and our caregivers in our community, but I'm hoping also some of our physicians listen to it, because I know I've learned so much from it.
Yeah, and this is a shout out to all of you out there. We love that you're with us. If you haven't listened to any of these podcasts yet, they are on the AIM website. You can go into the archive. You can find them, obviously, on Spotify, on iTunes. Let us know what you think and share with us topics that you want addressed. I love the chat, because I think many of you did bring up issues that have grown out of these podcasts. And I think it's exactly right. This is a very special community, and to stay connected, sharing these lessons is amazing. Well, thank you, Ray. It's always a treat. I love that you were able to join us. Like you, I'm very thankful that AIM offers this program, as well as many others, to support our patients.
Thank you, everyone who's listening, and let us know, give us your feedback, and always looking to make it better. Actually, and help you guys.